Okay, this video is the risk factors for breast cancer. And where does this come from? Well, I ran into some lady friends of mine, and they're wearing pink shirts, and they're saying, well, it's breast awareness time. We're going for mammograms. I said, and they're like saying that to me like they're proud of themselves, like they're intelligent or something. And I'm thinking to myself, I don't know what I think of that. What I'm trying to say is the establishment always wants you to be aware of a disease so you can go for a screening test. They make money off the mammogram, and if they can label you with a possible breast cancer, they can maybe do a biopsy on you, at least get a follow-up mammogram on you. Maybe they can diagnose a turtle, and they're going to treat it like it's a rabbit, and you're going to get chemo and surgery and all this stuff. They're going to make tons of money on you. So again, my attitude about screening studies is it's like, a couple of men sitting on top of the buildings in a shopping mall, and they throw a net on the people walking by to trap them and turn them into patients. What I'm trying to say is, there's a good video of Dr. McDougall interviewing Peter Gochke, and where he recommends no mammograms. And a lot of places have said no mammograms, less than 50 years of age, premenopausal. It's quite overrated. People who have no experience, patients are always a bunch of clueless idiots, and they always think, oh, I got to do something, proactive for my health, get a mammogram. They don't understand how dangerous all this stuff is. I remember when I was a resident, I hated mammography. All these women are crying, afraid they have breast cancer. Almost all of them have false positives. They're all freaked out. I hated it when I rotated through mammography. It's like my least favorite thing. It's as boring as anything could be, and all these women are emotional and freaked out and crying, and I'm the last guy in the world to be talking to hyper-emotional females. Okay, and I didn't know that much back then. But anyways, so what I'm trying to say is awareness is empowerment of the establishment to get you to turn yourself into a patient so they can take your money away from you. Whereas I'm going to give you the risk factors for breast cancer. Most of them are avoidable, and you can just minimize your risk to the point where it's so low, why even get a mammogram, okay? So here it comes. Oh, actually, I'll keep this covered up for now. So starting out, early onset of menarche. So if the kid's eating a lot of dairy and a lot of meat, they're going to hit puberty at a younger age. Puberty happens much younger than it used to. And then they're going to have more unopposed estrogen through the course of their life and be at increased risk for breast cancer. If a woman has an abortion, okay, they don't want you to know this. Another thing, too, I'm going to tell you, all of the breast cancer establishment sites, they're all fake. You say, well, how could I say that? I'll tell you why. It's obvious if you know anything about disease. Think about it. Imagine you are the foundation for multiple sclerosis. What would happen to your foundation for multiple sclerosis if somebody cured the disease? You'd have no patients. You'd go bankrupt, okay? So think about it. If you're the foundation for breast cancer or for any other disease, all foundations, in my personal experience, are always fake because they have 100% conflict of interest. The more patients that have their disease, the better chance they have to make money. The more patients that are cured, the less chance they have to make money. They don't want to cure the patient. All right, so they're not going to tell you stuff. Also, a lot of the people in the healthcare establishment business, they're basically puppets for the idea of population. Then you know what comes next? Control, okay? They want to reduce the population. They don't want you to know things that are going to increase population size. Like, if you have an abortion, you have not only do you remove one baby's life, one human being's life, you also increase your own risk of having breast cancer and shortening your life. So it'd be double population control for the establishment. Wouldn't they like that? Okay, the next thing is no pregnancy when you're less than 30 years of age. So then you have more prolonged unopposed estrogen. So basically, all of modernism is sort of designed to ruin a woman's life, and they're too stupid to realize it. Feminism, I told you before, comes from Satanism. I did an entire video on that. It makes women unattractive to men. If I dated a woman and she said she was a feminist, I'd say, it was nice meeting you, goodbye. I would not speak a single other word to her. That'd be done. There'd be no point in speaking to her. Because she's worthless as a companion or a maid. Feminism basically means hates men, okay? So, I don't want to deal with a woman who hates men. Why should I provide for her and protect her and shelter her the rest of her life if she hates men? She could piss off, all right? Also, modernism recommends promiscuity. Men hate promiscuity. If the woman is promiscuous, that means she's likely to cheat on you. You're unlikely to know if the kid's really your kid. She's more likely to give you a venereal disease. She's basically worthless. So all these things that are encouraged by modernism, promiscuity and feminism, basically make a female worthless to the point of a man. If you told me a woman was promiscuous and a feminist, I would not want to meet her. I don't care if she's a 10 out of 10 in beauty. I would consider her worthless. I would have zero interest in her. Okay, so let's continue here. Um, a woman, it's a good idea to have your first baby before you're 30. It really is. All right, next thing is if she doesn't have any kids at all, then she's got completely unopposed estrogen without a pregnancy. The more kids she has, she'll have less breast cancer. It's good to breastfeed the kid. If you don't breastfeed the kid, the risk of breast cancer is higher. It's better for the kid, better for the mom. Long-term use of oral contraceptives. Some of these pills, it sort of contributes to that whole unopposed estrogen routine. Some postmenopausal hormone replacement therapy. Okay, estrogenics in personal care products, especially deodorant. We talked about that. So deodorant is typically got aluminum in it, metalloestrogen. It's got parabenzoic acid as a preservative. The lymphatics between the breast and the upper outer quadrant are shared. It used to be about 20 in the 1920s, about 25% of breast cancer was upper outer quadrant. Now it's about 60%. So you got shared lymphatics between the two. If you're putting estrogenic chemicals stimulate proliferation of breast ductal cells. Most breast cancer is breast ductal carcinoma. So basically, you're pouring Miracle-Gro on your armpit onto your breast tissue every day, from the shared lymphatics to your upper outer quadrant. Stupid, okay? When you walk in a room, you say, "Hey, how you doing?" Deodorant is just conformist brainwashing. I've never worn deodorant. Even when I was a young guy, I'm like, that's bullshit. I'm not going to wear deodorant, Give me a break putting that crap on myself. So anyways, what I'm trying to say is, what does a typical woman do? She shaves her armpits, then she puts estrogenic chemicals in her armpit. Totally stupid. When you walk in the door in a room and say, "Hey, how you doing?" You don't sniff each other's armpits. By the time a man's sniffing your armpit, he already likes you, okay? And you probably like him if you're letting him do that, all right? Let's see, what else? All these personal care products are bad. They all have estrogenic preservatives in them because the corner of an estrogen molecule is a phenol group, meaning a benzene with a hydroxyl group. And it has great shelf life and it's antimicrobial. So it's the common preservative in just about all personal care products. Some of them have 2 or 3 estrogens in them. Aluminum, like I said, is a metalloestrogen. Like the typical woman, you tell them you shouldn't use deodorant because of the aluminum parabens. They're like, well, I'll get a deodorant that doesn't have aluminum and doesn't have parabens, but I'll bet you it has some other type of estrogenic in it. Okay, shampoos, conditioners, perfumes, lotions, sunscreen, they all have estrogens in them. A lot of sunscreens have multiple estrogens in them. Same thing with shampoos. Estrogenics in dishwashing and laundry detergents. Look, if you don't cook with oil, then you don't need laundry detergent. I'm sorry, you don't need dishwasher detergent. And unless you work like an oil rig, or something, some type of job like that, really dirty, you don't need laundry detergent. You don't need those softeners or anything. Just do it with hot water. I've done that for a long time. It works just fine. I know I don't use shampoo. I don't have much hair, but you don't need it. And even when I did, I used like the mildest form of baby shampoo, and that still had 2 or 3 estrogens in it. Okay, filter your tap water. There's tons of estrogenic chemicals in tap water, a whole bunch of them. There's phthalates, there's BPA, there's some woman's birth control pills. There's other ones as well. There's a lot of them. You can remove that all with carbon filters. Nice to have reverse osmosis to help remove aluminum as well. Dairy, the cows nowadays are engineered to be pregnant, so there's lots of estrogen. The estrogen levels are high when the cow's pregnant. It gets in the milk. Animals, when you eat meat, they're given estrogen a lot of times. It's a fat storage hormone to make them gain weight faster. Grilled meat's even worse with the cooking causes harmful chemicals on it. Lack of dietary fiber. The good bacteria feed off dietary fiber. When you don't eat dietary fiber, you get more bad gut bacteria. The bad gut bacteria have more of an enzyme, glucuronidase. The body excretes excess estrogen through the liver, and then it sends it into the bile, and then it's conjugated. It conjugates it in the liver to something called glucuronic acid. And then we defecate it out of our body to lower our estrogen levels. But if you don't eat fiber, you get more bad gut bacteria. They have more of an enzyme called glucuronidase. Glucuronidase cleaves the conjugation, so it separates the glucuronic acid from the estrogen. When the estrogen is separated from the glucuronic acid, it's deconjugated, then it becomes absorbed through our gut, so your estrogen levels go up, okay? And I actually think this is why black women have so many fibroids, tons of fibroids, because most of them are drinking tap water, eating processed food, eating meat, okay? So you want to filter your water. You want to avoid it. The best thing is a low-fat, low-sodium, 100% vegan diet with no oil. Okay, organic only. You want organic only because when it's non-organic, then like on all the corn, they spray atrazine. That's estrogenic. Glyphosate's estrogenic. So you want to avoid all that stuff. You don't want to be fat. Obesity, the extra fat makes the aromatase enzyme, makes more estrogen. Also, you can elevate growth factors, increase your risk of diabetes and hypertension. Both diabetes and hypertension are associated with increased risk of estrogen. Guess what? Low-fat vegan diet with low sodium. lowers your risk of diabetes, lowers your risk of hypertension, both dramatically. Okay. So you see, almost all of this stuff is avoidable. So I'm basically empowering you so you never get breast cancer. The incidence of breast cancer in old-time communities where they live kind of a more traditional lifestyle, kind of like what Christianity recommends to you, join your partner, get married, have a happy family, take care of each other, help each other out, breastfeed your kids. If you live your life that way, you'll be unlikely to ever get breast cancer. Okay, don't drink alcohol, don't smoke cigarettes. Both of those things are bad for your immune function. A lot of this stuff highlighted yellow is basically bad for your immune system. You need an immune system to remove cancer cells from your body. Being sedentary increases your risk of breast cancer because when you exercise, that's the pump. Your lymphatic system, lymphatic vessels, they're not connected to the heart. So they get pumped by you moving around and exercising. Your white blood cells travel through that lymphatic flow and they feel everything. It's all done by Braille. Are you, self or non-self? Self or non-self? Cancer is non-self, so they remove the cancer cells. In order to get increased WBCs traveling through your lymphatics, you need to exercise. You get 10 to 30 times more lymphatic flow by exercising, so improves immune function. When you sleep, your immune system functions a lot as well. If you're sleep deprived, you get elevated cortisol level. It's like being psychologically stressed. Cortisol suppresses your immune system. So if you work the night shifts, you get a lot of immune suppression, messes up your circadian rhythms. Women who work night shift for a couple decades, they have 50% increased risk of breast cancer. That's a lot. Excessive psychological stress. Caffeine does the same thing, elevates cortisol and catecholamines, the stress hormones. So it's an immune suppressant. Because when you're stressed, the purpose of being stressed is to survive the next half hour, being chased by a tiger in the dark. You don't need immune function. The body has limited resources. It shuts off the immune system when it's just trying to survive. So if you're chronically in that survival mode from excessive psychological stress, sleep deprivation, and caffeine, your immune system's chronically suppressed. High-fat diet suppresses the immune system. It doesn't work well in the context of a high-fat diet. The lady at Global Immunotalks, Lydia Lynch, the Irish lady, PhD from Princeton, now at Harvard, she's got a good talk on that. But it's pretty well known. High-fat diet suppresses the immune system. Excessive salt also suppresses the immune system a little bit. For example, it activates your platelets. Your platelets then can surround metastasizing cells in your blood and hide them from your immune system because it feels by Braille. If the metastasizing cell is covered by platelets, they can't feel it and they can't remove it. Switching things. Nowadays, a lot of modern lights are switched to blue LED lights. That's bad because our body, we have photoreceptors that don't perceive vision. They just perceive blue light. Blue light is perceived as daytime. So if you have excessive daytime at your house because you've got blue LED lights in your house and you've got, computer screens give off blue LED light and cell phones do as well. So people live in a longer perceived day. I told you about that book. The guy's name is, I think, Dr. Martin Eady. He's that Harvard guy, dropped out of surgical residency because he kept falling asleep during long cases because he was sleep deprived from being on call all the time, did a PhD in sleep medicine, and he was part of the discovery group that found out breast cancer pushes your, working night shift pushes your breast cancer risk way up. The point was, sunlight's 20,000 times brighter than indoor light, and darkness is about 20,000 times, this is approximate, darker than indoor light. So he says, we live in the twilight and we don't set our circadian rhythm. Our circadian rhythms are set by bright sunlight and blue lights in the sunlight, and you see the sky blue, and by darkness at night. But if you have this long, prolonged day of when you first wake up, you're on indoors all day long, and you're always looking at this twilight equivalent, you don't set your circadian rhythms very well, and your immune system doesn't function as well. You don't make as much melatonin. You don't sleep as well. You're sleep deprived. Your cortisol is elevated. Melatonin is, both a sleep hormone. It's also an antioxidant. It also is like a timekeeper. It tells your body when it's nighttime, and the body needs to be able to change shifts, so to speak. What else? Lack of sunshine. You get more sunshine for more vitamin D. Vasodilates your body. You get better mitochondrial function. Does a lot of good things. That's the best way to get vitamin D. I think the measurement numbers are exaggerated, that how many people are deficient, but you should get it from sunshine. As Dr. McDougall said, he'd only give vitamin D to somebody who was institutionalized and couldn't go outside. Otherwise, they should get it from the sun. Don't put your cell phone in your front pocket for a couple of decades. I've seen a lot of people do that. I have cardiology friends that were doing it, and I would make fun of them, you dummies, because it changes the EKG. You have a cell phone in the front pocket. It's a low-power microwave transmitter. The heart is electric. If you have that sitting on your breast, your low-power microwave in your breast for a couple of decades, not smart. You increase the risk of breast cancer. It's good to practice one of the major religions. People who practice one of the major religions, they're all overall healthier, less suicide, less divorce, longer lives. You lower your stress. You sort of give over some of it to God. You have more of an attitude of gratitude. Um, Weaker associations. Good social support also makes a person healthy, lowers their stress level. So try to get along with your friends and your family. Weaker associations. Volatile organic chemicals. Anything that smells bad. Also diesel exhaust, automobile exhaust. Non-stick cookware is thought to increase the risk. Perfluorinated. This is all coming from PubMed. And the reason I'm telling you this, you're going to hear when you go to like these mainstream sites, they're going to tell you, oh, there's no proven association. Just read PubMed. You'll see there's plenty of papers on these other subjects. Okay. Flame retardants and furniture. It's another reason why, like if I'm doing an operating room case where there's a chance cautery might use, you need the blue surgical gowns. Okay. But if you're doing a procedure that doesn't require full sterile gown, like let's say you're doing a suture removal, you don't need to wear those blue surgical gowns. They've got the flame retardants in them. You can just wear, a barrier gown or something like that. Smoking marijuana, again, it's a hypoxicant, lowers tissue oxygenation, increases your chance of a Warburg effect, favors cancer in a hypoxic environment, tumor microenvironment milieu, but also it's estrogenic, okay? Chronic periodontal disease is thought to increase the risk of breast cancer. It's associated with it. Underwire bras are associated with increased risk of breast cancer. So it's not good to have the metal wire there. I don't know if it functions like an antenna or something. Maybe it attracts EMF or something. I don't know the exact mechanism. So anyways, there's a whole bunch of things. Almost all of those things, you can control them. So you can do a ton of things to lower your risk of breast cancer. So that's your empowerment. I hope you found that helpful.